Hi, Michelle.
Hello, Michelle.
Hello. Can you please introduce yourself?
Yes, my name's David Mannino. I'm a respiratory medical expert for GlaxoSmithKline.
And my name is Candyce Norris, and I am a COPD patient.
Now, doctor, can you please tell me about your educational background?
Sure. I went to a medical school in Philadelphia at Jefferson. I then went to did my residency at Lankenau Hospital in Philadelphia. Went on to do a fellowship in West Virginia at University of West Virginia, and then went on to Centers for Disease Control, where I worked at the Air Pollution and Respiratory Health Branch for many years before I retired from that, and then went to University of Kentucky, where I was both in the College of Medicine and Public Health before I retired from that, and went on to take a position at GlaxoSmithKline as a respiratory medical expert. I still see patients at the University of Kentucky.
And now, where are you located now?
I actually still live in Lexington, Kentucky. I didn't have to move to take this position.
Oh, okay. Now, what's COPD?
COPD stands for chronic obstructive pulmonary disease, and that's an umbrella term that includes several different disease processes that have overlap. People might be familiar with the term emphysema or chronic bronchitis, and that's actually two of the most common manifestations that we see of COPD. But it affects about 14 million people in the U.S. have been diagnosed with COPD, but there are many millions more, perhaps as many as 13 to 14 million more people who have evidence of COPD but have not had that diagnosis.
Now, isn't COPD just kind of a cuter nickname for asthma?
No, and there are some patients with asthma who also have COPD. And some people may characterize an asthma attack that doesn't end as being COPD. But they are distinct diseases. Now, granted, there are some patients that have both asthma and COPD. We call that asthma-COPD overlap.
Sure, I actually said emphysema.
Oh, sorry, I thought you said asthma. And there's a patients with emphysema, most have COPD, but there's not 100% overlap.
Okay, so it's not quite the same.
It's not identical.
Now, what are the symptoms of COPD?
The symptoms of COPD are typically shortness of air, sometimes cough, wheezing, but sometimes they're more subtle. For example, some patients may just have fatigue. Some patients may attribute their symptoms to simply getting older, and they ignore them. For example, you might ask a patient, well, do you get short of breath when you exercise? And they'll say no, but the problem is that they don't really exercise. They just basically sit in their sit in their chair, working their finger on the remote control of the TV. So you have to be very careful about how one asks these questions.
Now, who tends to get COPD?
It's a disease of aging. In the U.S., the primary risk factor for COPD is cigarette smoking. However, just the fact that you have not smoked doesn't necessarily mean you won't get COPD, because if you look at adults in the U.S. who have evidence of COPD, around 25% of them have never smoked. So they have other risk factors such as early life respiratory infections, a history of asthma, being exposed to secondhand smoke, or being exposed to chemicals in the workplace. These can all factor in to a COPD diagnosis. If you go around the world, being exposed to certain types of fuels in your home, such as biomass, smoke, for cooking or heating, is a risk factor for COPD. And also in different parts of the world, including and parts of the U.S., poverty, being raised in a poor environment where you have poor housing or inadequate food, can also be a risk factor for the development of COPD.
Now, what are the percentages of people who get it based on risky behavior like smoking versus environmental concerns like asbestos or poverty?
Yeah. In the U.S., around 80% of COPD is attributable to cigarette smoking. Although, even in cigarette smokers, if you combine risk factors such as cigarette smoking with other environmental exposures, it increases your risk. So a lot of, different factors sort of, come into play together.
Now, what are treatment options for COPD?
Treatment options for COPD are sort of have to be tailored to the individual patient. For example, and in thinking about treatment options, all patients with COPD should have a reduction in their risk factors. So if they're smoking or are working in a dusty environment, that needs to be changed. And one needs to also prevent against infections. So we recommend immunization, for example, against pneumonia and influenza. And then all patients should have an exercise program. And Candyce here can attest to the value of exercise in the treatment of her COPD. And then beyond that, we have different therapies that are available, different inhaled medications, all of which, need to be tailored to an individual patient because different patients have different needs.
Candyce, can you please tell me your story?
Well, I was first diagnosed with COPD in 1996, and in the beginning I did not take it seriously, but eventually I did. It was not something that I could ignore any longer. I went to my doctor, opened up, told him all the symptoms that I was having. I involved my family, which is critical. I decided to manage my disease instead of letting it manage me. I have a workout program. I work full-time. I watch what I eat, so I take my medicine as the doctor has set up for me, and so it's made a world of difference in my story. As far as research, I've looked into copdfoundation.org, which has an incredible amount of information that can really help those people out there searching.
That sounds very good. Doctor, it seems like there's a lot of misdiagnosis for people who may have COPD and not know it. What should people be looking for?
I think people can be looking for a number of different things, and certainly if they're unable to keep up with people of their own age because they get short of air, that is something that is very indicative of COPD. But sometimes it can just be fatigue. Often patients with COPD have other diseases that can affect their ability to be correctly diagnosed, and this can be other diseases such as depression, anxiety, sometimes heart disease, high blood pressure, diabetes. That all these are factors that are important. But it's important to have that conversation with your physician. And because as I tell my patients, it's important to not only, when we want to add more years to a patient's life, but we also want to add more life to their years so that they are able to do all the activities that people expect as they get older. And they want to be able to go on vacations and be able to go to important events such as graduations and weddings of their children and grandchildren. And that's something that I strive for all my COPD patients to be able to do.
Now, where can people get more information?
I recommend that they go to the website of the COPD Foundation, which is copdfoundation.org. There's information there not only for patients, but for caretakers of patients and also for physicians.
Is there anything either of you would like to add?
Thank you for having us on. I think this is important, and this is COPD Awareness Month, so this is a great opportunity to get the word out.
All right. Thank you very much for your time. Hope you have a great day.
Thank you, Michelle.
Thanks,
You
Michelle.
also.